Hi guys, so welcome to another Go Live session with Podmed Adventures. We have a very special guest today, Dr. Jonathan Rouse. So the main thing that we're going to be talking about today is the whole process of choosing a residency program and how interviews work and things like that. I know this is something that's very, very confusing to a lot of us, including me, and I really want to make sure that we have good knowledge after this session. So if you guys have any questions or anything like that, feel free to type it in the comment or in the question box, and we'll for sure ask Dr. Rouse about it. So without further ado, let me invite Dr. Rouse to our Go Live channel. Let's see. We're having some technical difficulty here. There we go. Okay. Hi, everyone. Hello, Dr. Rouse.
Hi.
How are you?
Good. I don't want to correct you right away, but it's Rouse, not Rouse.
Rouse. Okay. Thanks for correcting me.
Yeah.
Better early than late.
Yeah.
So everyone who's joining right now, we're meeting with Dr. Rouse right now, and we'll be talking about where he did his residency, where he went to school, and main topic for today is going to be choosing a residency program, the qualities that residency programs require for you to have, things like that. So Dr. Rouse, tell us a little bit about yourself. Where do you live right now, and what led you to podiatry?
Okay. So right now I live in Wadsworth, Illinois, which is north Chicago, like near the Wisconsin border. Originally from Nebraska, so I'm used to snow. So it's nice.
Yeah.
And yeah, I like podiatry just because it was I shadowed probably 10 different specialties.
Okay.
Before I was applying to schools and everything, and I really liked the variability of it every day. So it's not even every day, just each patient's totally different. Like you see wound care patient one time, next patient's sports medicine, and on. So that's what led me to kind of yeah.
So what did you think it was so different from the other specialties that you shadowed?
I just like that it's not just, we get to focus on one part of the body. Big for me, because I feel like then we could be an expert at something, but we also get to pick and choose like dermatology or sports medicine or trauma, reconstructive surgery. So that's kind of what I liked about it. Yeah.
Yeah, I feel like I have very similar experience as well, where I feel like the fact that you have it's just so diverse compared to other specialties, I would say, is that you have so much room, and you also get a wide range of patients that we work with as well. So it's very exciting, and you're always learning new things.
Yeah.
So where did you go to school for podiatry?
Arizona, I went to school.
Okay. How was that?
It was good.
From snow to no snow?
Yeah. It was, I actually missed the seasons once we were there. We thought it was going to be fun, but it was fun, but you're so busy. It's you didn't even get to enjoy the weather. And then the summer is like winter because you can't get outside.
Right.
Yeah. It was a great school, a great experience.
Yeah.
I'm glad I went there. So.
Yeah, that's what I feel like I feel it here as well. In California, I feel like there's so many things to do, but you never get the chance to experience anything. Every time someone says oh, how do you like California? I was like, I don't know, I'll find out soon, I guess. After 2 years of okay, now I know what California is like. So yeah, totally get that. Were you so when was the year that you graduated from Arizona?
I graduated in 2013.
Okay, 2013. And then from there, where'd you start your residency?
Residency, it was called Long Island Jewish Medical Center in New York. And then it just changed names, I think, to Northwell Health. So there's a bunch of them up there, the proper one in Queens / Long Island.
Okay. Okay, so like it seemed like you've had like you've lived at so many different places. You had like so many different experiences everywhere.
Yeah.
Yeah, it must be different. So how did you choose that place? Is that anything related to
The
your
pizza.
pizza? Okay, yeah. I guess like right now, like you're in Chicago, right?
Yeah, yeah, yeah.
Yeah. So it's
Yeah.
like another pizza place too.
Booked that residency because I felt like it was the most well-rounded program I went to, and
Uh-huh.
the residents who graduated from there, they're just very, very competent, and a lot of them were attendings at the program, and
Okay.
saw that the residents do most of the case and surgery, which is something to look for as a student,
Uh-huh.
because you could have 900 numbers, but if you're not doing the actual procedure, um, it's not
You
really
don't
cool.
really get that.
That's why I like that so much.
So before you chose that program, like did you visit it before?
No, I
No, you
didn't.
didn't visit before. Okay.
So I was kind of crazy, but I went through like everything on the Casper website or the clerkship, and I read about all the programs because I knew I wanted to kind of go to the Northeast. Um, and then I just contacted programs to find more
Okay.
information out, which I encourage people to do because
Right.
you're going based off a piece of paper, you know?
Yeah. Yeah.
Yeah.
I agree with that. So like how did you select how did you select from like Casper? Like just based off of like the information that you had on the paper?
What do you mean?
Like whatever information that the website had
Yeah,
is what you went through. Okay.
yeah. Each program has a like synopsis at the bottom about what they kind of focus on, what they do. So I kind of went by that. Yeah.
Okay. So like for any students like who are looking into it, so that would be like starting point A, right?
Yeah.
Okay. So from there, what did you do?
I mean, everyone has different goals in mind, so you can either like find a certain locale that you want to be and then check programs there, like I kind of did. Or if you don't care, you're gonna have to go through every.
Single one.
Yeah, yeah.
Okay. So basically, as you're selecting, like you look at the information, that's step number one, and then you keep where you want to be. That would be step number two. And then you also talked about like how many cases that they do.
Yeah,
That
and
would be another thing.
wherever you think you're gonna get the best training, like it's only 3 years of your life.
Yeah.
Yeah, it goes very quickly.
Did your family move with you?
So fourth year, I'm married. I had my first daughter at that time. So they actually moved back while I did my rotations.
Okay.
And then they all moved with us in New York. Yeah.
Okay. Wow. That must have been a big move.
Yeah. Yeah.
Yeah. So that was in 2013. So now you're back in Illinois. So how did you end up there?
So I joined the Navy out of, actually right after Podiatric school is when I joined the Navy.
Uh-huh.
And so I did residency and I was active duty during residency. And then I had to go to Rhode Island for training for 5 weeks. And then I actually got stationed at the place that I work at now. So it's like a half VA, half naval base. So it's an active naval base mixed with the VA, essentially. But which is why I decided to kind of stay within the VA system because this one's kind of fun to work at.
Yeah. Okay.
Told me I was coming here, so then we just stayed.
Is there any specific reason that you joined the Navy? Anything that like attracted you there? Or what are the things that you thought was amazing, which kind of pulled you towards that?
One of my grandfathers was in the Navy. The other one was a Marine, which is a branch of the Marines are a branch of the Navy, but don't tell them that, they get mad.
Okay.
That just separated, I think, so now they are their own branch. But they had the Army had some podiatry stuff going on too, like scholarships, but it wasn't too clear. So I just went with the Navy one. So they actually paid me a salary while I was in residency. So I got my Navy salary and my resident salary, and then I was responsible for putting my money towards the loans or buying a Lamborghini, whatever I want.
Yeah, honestly, like right now, like second year, like every time I'm looking at like how much loan I have accrued, I was like, oh my gosh, like how am I gonna get rid of it? So it seems like going to VA and like joining the Navy was like a good opportunity that we should all try to take advantage of for sure.
Yeah, or even if you work in, I mean, I can talk for hours on this stuff, but
No, go for it, because
like,
we don't really know much about it.
if you're working at a hospital as a resident, you should be filling out your public student loan forgiveness, because most hospitals are nonprofit hospitals, which counts. So your 3 years in residency, you can be doing the public student loan forgiveness tract, and even if you don't pursue it afterwards, you at least have 3 years built up.
Right.
So you have to work 10 years to get it forgiven. Because I mean,
Okay.
if you would have told me I was going to work at a VA when I was a resident, I wouldn't have believed you. You know.
Yeah.
So.
Yeah. So basically, when you're doing your 3-year residency, that counts towards that 10 years as well?
Yeah, as long as you're making payments. And your hospital has to be like a certain tax category.
Okay. Wow. I didn't know about that. That's a really good information. So what differences did you see like working in a VA hospital versus like any other hospital that you worked at?
Well, I mean, I guess like I said, the VA hospital ours is different because it's active duty people. So we have a ton of fractures. We have a lot of like flat foot and ankle reconstructions for the active people. And then it's nice because the vets have like the long-term problems like the arthritis, and so they're needing fusions and stuff like that. So it's a good mix of RVA. I mean, of course, we trim nails because that's podiatry and that done, right? But yeah, and we actually do less wound care than other VAs that I've been to.
Okay. So from there, how did you transition into becoming a residency director?
So it was kind of in my long-term plans, but it actually just kind of fell in my lap. So mixed with a program, and that program decided to stop funding the program, and they were going to just like get rid of the residents, and I'm like, that can't happen. That would ruin 9 people's lives. So I just took over the program and transferred everything to our hospital and got some new affiliation agreements. And then, so we only take 1 a year now, just so I can get everything stabilized and get some quality numbers for the people or for the residents. But yeah, it honestly just fell in my lap. I wish I could say I just started it from scratch, but.
Hey, I'm sure like it was a lot of work for you to like just transfer it. Like,
oh, it was horrible. It was
yeah. So I'm sure like you possess like amazing qualities to have to like transfer all those things. So like what are some skills and characteristics that you feel like that helped you do that?
Being organized helped a lot.
Yeah.
I guess being able to communicate well with others, because I had to contact or work with like the CPME and the VA central office to get funding, and communication is the most important skill that you can possess. It will take you far. If you're able to communicate what you need, and yeah, it'll just, in my experience, has helped me the most, is being able to talk to people.
Okay, so basically like to have that much responsibility, like it's really important for us to be very organized, have great communication skills, and if like have a really big goal to have it reach at a certain point. So what else have you been up to this past weekend?
I just got back from CRIP, actually, the interview.
Can you explain what CRIP is?
It's the Central Residency Interview Process, so or centralized. That's where everyone goes to Texas, and they just interview with the programs. So there's a West Coast interview and then an East Coast interview.
Okay.
East Coast is actually interviewing. They started today, I believe. All the VAs go at the same time, but yeah, it was fun.
So I'm from Texas too. I'm actually from Dallas, Texas, and I know like the interviews I'm guessing for West Coast gets held in Frisco, Texas, correct?
Yeah, they both do, yes.
Okay, so is it only a day-long interview, like just Saturday?
So some programs will do like I interviewed all mine on Thursday, and then we were done.
Okay.
I had to stay extra for ABPM stuff, and then like my buddy who's a program director in Phoenix, he interviewed some Thursday and some on Friday. So it's totally variable, but most students, if you're kind of all over the country, you're going to be there for a week.
Okay.
And 5 interviews or 2 interviews or 20 interviews, you may be there for a whole week.
So basically it's like a week-long process.
Yeah.
And a bunch of I guess like a lot of residency programs that are mostly on the West Coast gather there. Is that right?
No, I would say like 90% of the residencies go there. Some hold them in their city where the program is because they don't have the funding to go or they don't want to go. But yeah, so West Coast comes and then East Coast comes. So everyone goes to that location, which is actually, it's nicer for the students because you guys pay like one flight to go there and then you just stay there. With other specialties, they have to actually go to each location and interview. It can get very expensive.
So can you paint a picture for us of like what it's like what happens like for a day, like from morning to end of the day?
Yeah. So there's free breakfast at the Embassy Suites. So everyone's usually down there eating.
That's perk.
Yeah. And, I think we started at 8. Some programs have 20-minute interviews. Some have 30. Some have even longer, which is rare. And, you kind of you'll sit in a chair outside the room. They'll come grab you. Okay. They just make you cry.
Oh, no.
It's stressful. It is stressful because it's like plays a big part in your life, but most they want before they go to CRIP. And I think the interview process is usually, it messes with the middle ranks. It doesn't mess with like your top ranks as a program director. Okay. So it kind of solidifies, like if you think someone's weak in something, you can give them a case. If you remember that they had a tough time suturing, like I would give someone suture and then I would rapid fire question them. I try to make it fun. I know it's a stressful environment, and but I'm sure you also want to see like how students like interact in a very stressful situation, because like that's part of their career. So that makes sense. I didn't know, like that's an interesting information that like you said, like you give a suture kit like to have them sew as well. Yeah, I actually had them reach into a bag, and I said it was a mystery bag of tricks, and it was just all suture stuff, but it was kind of fun. Yeah, that sounds really fun. Yeah. So you just gotta go in like prepared. They're like, okay, anything can happen. Yep. Is that right? Okay. Some places will give you, it's rare, but they'll give you like a bar of soap and say, carve me a talus. Some are just social interviews. Some have like rapid fire questions on the screen where they give you like 30 seconds to just answer a question for like 6 minutes. It's totally variable. So what qualities do you feel like students have, like all the students that do really good on those interviews? I put some weight into, from my perspective, I put some weight into the interview process. But I really feel like your month externship that's your interview. So in that regard, be early, stay late, ask questions at the time and appropriately, and just be open to learning and be like motivated and inquisitive, and that's what kind of will set you at the top. Okay. So I know like most people like choose their residency based on the clerkship that they go to. So, but I also know there are people like who end up at a residency that have never been to before. So how important it is for them for this like interviews that you guys have? Yeah. So, it's important to at least visit because you need to know what you're getting yourself into. Okay. It could be, you could get in, my cousin's down there. You could get into a situation where you don't know anything about the hospital and they accepted you there. So, it's kind of like going blind. So you at least need to visit, and maybe even more than once. And if you interview, I forgot what I was going to say. I was reading down there. Oh, if you interview at a place where you did not rotate or visit, they're going to destroy you in the interview. Okay. And that's just because they need to get to know you in a short period of time. Yeah. And then like a callback where they'll call you back and do like a second interview. Okay. Okay. So we had like a question from like one of the viewers. They're asking that
would you guys say that externship students get picked more often versus?
Yeah.
Yeah.
Like it's like, would you rather marry someone you dated for a month, or would you rather marry someone that you don't even know?
Right. Yeah. So say like we only get 6 externships, right?
Okay.
So sometimes, is that right? Like every schools do 6.
I only had 4 actually. I think they
You have
increased.
4. Okay.
Yeah.
So my school does 6 internships, and like oftentimes students run into the problem that like, okay, these are the top 6 that I want to go to, but I also wanted to go to this one, but it's not really fitting well with my schedule. So in that case, you suggest that like they should go visit the program.
Go
and
visit.
then
And make sure you visit on a day where the program director's there.
Okay, good
So,
tip.
I'm going to answer that question down there. Not getting a call back is, most places don't do callbacks, but it's not necessarily a bad sign if you don't get one. It's just it could be because they like you, it could be because they need to know more information about you, but not getting one is not a nail in the coffin. So I would still rank it if you want to go there.
So that brings me to another question is, can you explain the ranking process? Because like, I feel like that's very, very confusing. You can't.
No,
You're not allowed to.
it's in the favor of the students.
Okay.
Rank where you want to go.
Uh-huh.
A lot of gossip at the interviews, and don't listen to what anyone says. Just if you want to go to a place and you think you have a long shot, put it as one. It doesn't hurt you. Yeah, that's my biggest advice. Rank it how you want it.
So that's another thing that I feel like we are a little confused about. Like, so we rank the programs that we want to go to, and then the other programs rank us as well.
Yeah. So like I have my rank list, and then the students have their rank list.
Okay.
So
and same
way on my end, I don't try to play like the game, because I don't think trying to play the game actually works. I just rank the people I want in the order I would want them, and then the students do the same. It should work.
Okay. So that's like when the numbers match that's when you get matched.
Yeah.
Is what it is. Okay.
So like if I 1, or you ranked my program 1, but I ranked 6, sorry, and the other 5 people didn't match with me, then you would match with me, because it goes in favor.
It almost like, to me, it almost sounds like a gambling game as well, because I feel like you don't know how someone's gonna like rank you, or like after an externship you kind of have an idea.
Yeah, you kind of have an idea. Like places will tell you like, you're one of the top in the program. They're actually not supposed to tell you where they're ranking you, and they're ask you how you're ranking the program.
Okay.
So yeah.
So we have a few more questions here. How long is the rank list, and top 6 programs or more?
As many as you want.
Okay.
Apply to 75 programs if you want.
Oh, wow.
And
so what is the typical numbers people to rank?
It depends. I actually only did 2 when I was a student.
Oh.
And just because some of the places I went to, I didn't see myself working there, so I would have rather scrambled than match with them. And that's another thing too. Like if you rank a program, you might end up there. So if you truly don't like it, don't rank it, because it happens. But it just depends on how you feel about the programs.
So what is an externship for those that don't want to scramble at the very end?
What's that?
So like if they're like trying to like scramble, like, so how does that process work? Like you didn't get matched, so what does that mean when you're scrambling?
Part 2, there was not when I was a student, but so now it works. So if you don't match, the applicants find out like 2 hours before, I think, and the programs find out as well, but they don't. Yeah, and then so the students can get their packages ready to send out to the programs again. So the students get a list, and then the programs get a list. So you may get like some phone call interviews. And some programs just, for some reason, don't rank a lot of people. That causes them to scramble as well. Okay. But scrambling isn't necessarily a horrible thing. Okay. You didn't rank enough programs. Maybe the programs didn't rank people. So it's not a horrible thing. but it happens.
Yeah. We have another question is that, is it smarter to do an externship closer to the interview so people remember you?
No.
Not
Just
necessarily.
program if you liked it.
Yeah, that. I feel like it's a month-long externship, so I feel like it's a long time that the program and the student get to know each other very well, right?
Yeah. Yeah.
So when you choose someone for an externship, what are you looking for?
I actually am not our externship director.
Okay.
One of my colleagues is the externship director. So,
Okay.
I mean, we have a minimum GPA, but we're right across the street from Shoal. So we
Right.
have all students coming through. We have like 6 to 8 a month.
Okay.
Course. So we usually choose from them, but we do have a Kent second year and an Iowa second year as well.
So does your program, I'm guessing like every program probably typically ranks the people that they externed with. Do you also rank the people that visited your program?
Well, it depends. So I might give them an interview.
Mm-hmm.
But yeah, I don't think I interviewed anyone this year who just visited. I don't think anyone just visit and then apply.
So basically it's very important that if you really want to go to a program, make sure you do an externship there first.
Mhm.
Okay. So I know you said like you're residency director. I know you're also involved with ABPM. What's your role there, and what advice do you have for students who are getting ready to take their board exam in July?
The like part one?
Mm-hmm.
Oh, the MBPME. Okay.
Yeah.
Study. Part one is one of those tests where you like leave it and you're like, did I pass that? Most people pass it, but I mean, you have to study. It's hard.
So how many hours would you say that people should be spending preparing just for the boards?
However many it takes.
Yeah.
Everyone's different, but don't wait till the last minute. Just keep studying a little bit every day.
So what's your role in that?
So, are you asking the ABPM or
Yeah.
B? So the
ABPM.
Okay, ABPM. So I kind of do a lot of stuff for them. So I am on the exam committee, so I help write the qualification exam, and then review certification exam questions. Is what we did at the meeting, and then I'm the sub chair of social media on the marketing committee. So their Instagram page with like the tip of the week and Wisdom Wednesdays and stuff. Me and her name's Grace. She's at the ABPM. She's awesome. Shout out. We put stuff together because we know people like board review kind of type questions, what they would see on the exam.
Right.
So we throw that stuff on there. Yeah.
So I know like you're doing a lot of things. Like I know you told me that you have a daughter. Do you have more kids?
I have 4 kids.
You have 4 kids. Wow.
Yeah.
So you have 4 kids, you're a residency director, and you're also helping with like podiatry board exams. So how do you juggle your time? What's your advice for people like who are in the same boat as you, and some advice that you have for students as well?
I guess my first advice is find someone who understands your life.
Yeah.
Like Foot Doc Kumar said or whatever on his Go Live, it's very important to have someone who supports you, because I travel a lot now too. That's important. That can put a lot of stress on your life if you don't have that. Secondly, don't say no to anything until you are actually too busy. I finally started saying no to some stuff because I'm just so busy now, but I think that's why I've been able to kind of jump on a bunch of different ships and expand my CV a little bit.
So you basically like prioritize things that
Yeah.
you're working on.
Yeah.
So do you have anything else that you would like to share with the rest of the audience?
I don't think so. I'll be at the basketball tournament or something's in Nashville.
Mm-hmm.
Yeah.
You're going there?
I'll be there for with the ABPM. Yeah. So if anyone has any questions, they can swing by the booth and talk to me, or just come say.
Sounds good.
And then I would say if people are interested in like board review questions, they can follow. It's at Podiatry Board. That's the ABPM Instagram name.
I think we have one more question that someone posted. It says, I read your ABPM post, but what advice do you have for the job search at the end of residency?
Well, you shouldn't wait till the end of residency to find a job. Most, I wouldn't say most, but a lot of jobs, good jobs are unadvertised. It's just kind of going around, cold calling, using your residency director or attendings to find someone. A lot of attendings will hire residents out of residency to work with them. Yeah, I can't remember. There's like podiatryjobs.com, I think people post on. I encourage people to go to the VA just because they passed the VA Equity Act bill, so we paid like the real physicians now, which is nice. We'll cap out at a certain amount. So
basically, it's also when you're looking for a location for your residency, you also want to kind of keep in mind whether you would like to practice there as well. Yeah,
so that's, and I see people having problems with that as well, though, too. So if you're like, I want to go practice in Houston, Texas, right? Only so many places that could potentially hire you in Houston, Texas. If you're open wherever, you're going to be able to find a job, no problem.
Okay.
So I would say try and narrow it down by region or state, but if you're looking for a specific city, it might be kind of hard unless you know somebody, have like a family member, or you're just going to start your own practice.
Okay. Yeah, that's what I feel like. That's a main thing that a lot of us run into. It's like, hey, like I really want to go back to where I used to live before. I really want to work in the city. And like that's how people like don't end up where they want to end up at. And I feel like I'm a victim of it.
Working in big cities they're kind of saturated. So it's better to kind of find a rural community or get a little bit out of the city. You'll have more patients coming to you.
Do you know anyone who started their own private practice?
I do.
Residency? Okay.
And I was actually this close to starting mine in Nebraska.
Oh, wow.
Like I was talking to the bank to get funding, but then the VA bill passed, and then I was asked to kind of stay there. So
I guess like we can do another one where you can talk a little bit more about like different areas and different locations, that type of practices that people have and like what it's like. So that would be probably like another step for us.
Yeah.
Well, thank you so much for sharing all your experience. We'll definitely would love to have you on our Go Live again. I'm sure we're going to get so many questions even after the Go Live. So thank you very much.
Yeah. Thanks.
Thank you. Talk to you soon. Bye.
Bye.
Hi guys, thank you so much for joining our Go Live session. We do have a winner for our New Balance giveaway, so stay tuned. We're going to announce that next week, and we're so excited about it. Again, thank you so much for joining us today. Bye.